Before learning how a copper IUD works, let's explore the female reproductive system and understand where the device is placed. The copper IUD is placed inside the uterine cavity. To understand how it works, it's important to first identify the uterus, its lining, and the pathway leading to the fallopian tubes. A copper IUD is a small T-shaped contraceptive device wrapped with copper. It is designed to sit safely inside the uterus and provide long-lasting, hormone-free birth control.
The copper IUD rests inside the uterine cavity. It remains securely in place for long-term contraception. This allows the uterus to function normally.
A copper IUD continuously releases tiny amounts of copper ions into the uterus. This creates an environment that makes it much harder for sperm to survive and move normally. After entering the uterus, sperm encounter a copper-rich environment. The copper ions reduce their ability to move effectively, making it much more difficult for them to continue their journey. Because the sperm are weakened by the copper-rich environment, they are far less likely to reach and fertilize the egg. This is the primary way a copper IUD helps prevent pregnancy. Because fertilization usually does not occur, there is no fertilized egg available to implant in the uterine lining. This is how a copper IUD effectively helps prevent pregnancy. When placed correctly, a copper IUD is more than 99% effective at preventing pregnancy and can provide reliable, hormone-free protection. The copper IUD is hormone-free, highly effective, long-lasting, and fully reversible. Once it is removed by a healthcare professional, fertility usually returns quickly. Some people may experience heavier periods or stronger menstrual cramps, especially during the first few months after insertion. These symptoms often improve over time, but persist. A copper IUD is a suitable long-term birth control option for many adults. However, the best choice depends on individual health. When inserted by a qualified healthcare professional within 5 days after unprotected intercourse, a copper IUD is one of the most effective forms of emergency contraception. A copper IUD can be removed at any time by a qualified healthcare professional. After removal, fertility usually returns, making it a fully reversible form of long-term contraception. The copper IUD is a highly effective, hormone-free, long-term, and reversible method of contraception. We hope this animation helped you understand how it works.